Welcome back to Toledo Clinic TV. Our guest this segment is Dr. Jay Smith, a sports medicine specialist. Welcome.
Thank you.
And so you treat a lot of injuries, but there's a preventative side component to what you're doing. And so maybe you could just give us some tips about, when you're active, ways that you can stay healthy.
Yeah, so first let's start off with the fact that we want people to be active. We know people live longer, happier, healthier lives when they're more physically active. I don't know of any of our partners here at the Toledo Clinic that wouldn't appreciate me telling our patients or any patient to exercise. The biggest thing is making sure you're ready for exercise, and I think that's important. So making sure that if you've got an orthopedic concern, that we address it first. If you've got a medical concern, we address it first, and make sure that your primary care provider clears you to begin exercise, because exercise is easy. It could be as easy as going out, walking. We talk to people about going at a pace where you're able to talk, but you're not able to sing, just to get your heart rate up. And we look at about 300 minutes a week, and you can slice that any way you want. So you could do blocks of 75 minutes, you could do 30 to 60 minutes a day, but the biggest thing is doing it, and being ready to do it is what I think we're all about.
Are there specific exercises, stretches, things that people should be doing before they embark on activity?
Yeah, it depends on the activity that they want to do. So, if you're walking, you want to work on your lower extremity, maybe stretch out your back, your legs.
In your practice, what kinds of patients are you seeing? Are you seeing those who are trying to get ready for activity? Have they had an injury? Combination of both?
We run the gamut. I think we see more after the fact, because folks don't typically think about going to their provider before they engage in physical activity. And I think that's fine. I mean, I always like to clean up messes, but it's always better to prevent those things beforehand. And certainly, if you're looking to get into an exercise program, say starting back to running, I think that's a great example. It's sometimes better to get that advice before just jumping in and then getting hurt and then dealing with the consequences of injury.
And why would someone come to see you, say, versus an orthopedic?
Well,
Doctor?
I think we do a little bit of a better job treating patients that really aren't looking for a surgery. Surgeons are wonderful, important partners, but they're meant to do surgery. That's where they're happiest. My job is to look at the total body, the total person, and see what we can do to make them better.
All right. Thank you so much for being with us.
Happy to be here.
And thank you for watching.